On the occasion of Breastfeeding Awareness Month, we have with us expert Dr.
Hello everyone, this is Dr. Archana Rao. I'm a consultant obstetrician and gynecologist at Isha Hospitals, Boduppal.
Doctor, can you tell us why breastfeeding is so important for both mothers and babies?
Breastfeeding is important for both mother and baby because for babies, breastfeeding has a lot of nutrients and antibodies which help in preventing diseases and infection, and it also helps in the development and growth of the baby. And for mothers, it's helpful because it prevents certain cancer, and also it helps to support recovery during postpartum period, and also it helps in enhancing the bond between the mother and the baby. First of all, breastfeeding, every act of breastfeeding, a hormone called oxytocin gets released, and actually a love hormone increases the feeling of love and comfort for both mother and baby. And also during breastfeeding, the close contact between the mother and the baby, the skin to skin attachment, it creates a sense of comfort and also security for the baby. And also the eye to eye contact and intimacy between the mother and the baby during breastfeeding increases the bond between both of them, and also it's a way of communication.
Doctor, what is the ideal duration of breastfeeding? For how many months should a baby be breastfed?
Okay, according to World Health Organization, exclusive breastfeeding for the first 6 months is essential for every child, and also after 6 months, after initiation of solid food, along with that, breastfeeding should be continued till 2 years of age and beyond, because the more you breastfeed, the more immunity your child gains, the more nutrients your child gets.
Doctor, that's wonderful. How would you describe the current breastfeeding scenario in India?
Actually, breastfeeding is regularly practiced in India, but exclusive breastfeeding for 6 months, the rate is not up to the mark because of lack of information or lack of inadequate support system and some social pressures. So it's really important to exclusively breastfeed your kid for the first 6 months of life, because this is what you can do for your child, because if the child's future immunity to diseases and all will be mostly based on how good you breastfeed your child.
Doctor, what are some of the major challenges that mothers face and how can they be addressed?
Actually, most important problem every woman faces and most common thing is that insufficient milk production. Insufficient milk production leads to inefficient feeding, and like the nutritional demands of the baby is not met properly. If any woman issues with insufficient milk production, first thing you should take proper nutrition during breastfeeding. You should take good protein diet and all. And also, even if it is less, there are on-the-counter medicines which will enhance milk production, and also there are some Ayurvedic products which increases breastfeeding.
Thank you, doctor, for these valuable insights. Any final message for our listeners?
I advise each and every woman that breastfeeding is the most important because, as I said earlier, the child's future immunity towards diseases completely relies on how good you have breastfed your child.
Thank you, Dr. M. Archana Rao, for your message.